History has shown us that this legislation will have a dramatic positive impact not only on our economy, but on the well-being and the health care of our residents. We have watched as more residents, through federal health care reform, signed up for health insurance. We watch more residents have insurance and start to utilize their health insurance at more appropriate locations, increasing the quality of their health care and reducing costs for health care overall, and most importantly, as this legislation will do, help to protect the taxpayer. Many of us remember that we used to fund $700 to $800 million a year in charity care costs, trying to get matching Medicaid dollars, Medicaid funds from the federal government to offset costs for uninsured people in the state, one of the wealthiest states in the country, with the highest per capita income, with our largest employer being healthcare providers. And we watch people, in spite of our wealth, in spite of our experience, in spite of our employment base, people choose to not have insurance because they couldn't afford it. By requiring insurance, we bring down the cost for all, we spread the cost out for the sickest among us, and we allow people access to the greatest quality health care really anywhere in the nation at the lowest cost and at the appropriate setting. Without the requirement of health insurance, what we saw were people who couldn't afford health insurance putting off their health care needs to the latest time and ultimately choosing to seek health care in our hospitals, in our emergency rooms, driving up our charity care cost and driving up the cost for our taxpayers, where we ultimately had to pick up that cost. This spreads that cost fairly across the board. It gets us health access for our youngest of children. It gets it for our sickest of residents, and it allows our residents to live with dignity and know that their health care does not become a second-tier issue for them and their ability to afford to live in this state.